लोकल जे लोक आहात त्या लोकांची कमिटी कडे ऑफिशियल कमिटी टुरिझम डिपार्टमेंटान करपा जाय आणि टुरिस्ट पुलीस जे आसा ते तांकां सांगपा जाय की कमिटी कडेन डेली तुमी हें करा इंटरेक्ट करा आणि कितें आसा तांचे व्ह्यूज जे आसा ते घेया म्हणून तुमी तेन्ना हें कंट्रोलान येतलें अदरवायज हें कंट्रोलान येवपा ना ते जी लोकल कमिटी आहा त्या कमिटीक पावर दिवपाय तुमी त्या पुलिसांक सांगपाय तांकां आयकया म्हणून कमिटीचें आणि आयकना जाल्यार रिपोर्ट करपाचो तुमकां नाल्यार चीफ मिनिस्टराक तेन्ना हें जाग्यार येतलें अदरवायज हें जाग्यार येवपा ना हें अदरवायज इट इज व्हेरी डिफिकल्ट टू कंट्रोल इट.
Responding to the appeal made by the Catholic Bishops' Conference of India, New Delhi, all institutions in the state belonging to the Archdiocese Board of Education remained closed today.
The schools were directed to remain closed to express solidarity with those affected by the atrocities on the Christian community and other innocent people in Orissa. Schools and colleges run by the Archdiocesan Board of Education in the cities of Panjim, Margao and Vasco bore a deserted look as staff and students stayed home. Speaking to Goa 365, the principal of Don Bosco College, Panjim, Dr. Maria Raj, told us the reasons as to why the Catholic institutes remain closed.
The main reason being with the atrocities that have been committed in Orissa. So all the Catholic institutions all over India are trying to focus on this issue, and we by suspending classes are making a token protest of the way in which things are handled. Now all of us know, yes, there may be some kind of activities which are not really good to be which is taking place over there. So, but the manner in which is being done, innocent people being burnt, and people who are doing good, the nuns and the priests who are doing a lot of work, this is not the way to go about things. So all the institutions together are trying to focus on this and to point out to the government or the authorities concerned that there is a better way of handling it, and that also the issue needs to be studied thoroughly and before any kind of action is taken against it.
The resident doctors of the Goa Medical College and Hospital held a peaceful march within the campus of the Goa Medical College yesterday in protest against the recent assault on resident doctor on duty by the daughter of a patient who passed away. The relative, in an emotionally charged outburst, struck the doctor when he informed her about the demise of her mother who had been ailing for a while.
The strike call received participation from more than 200 resident doctors of the Goa Association of Resident Doctors. Speaking to Goa 365, Dr. George, the junior resident from the Department of Medicine who was assaulted by the young lady, gave us an insight into the incident.
This patient Jyoti Mambre was very much seriously ill. As you must be knowing, she was hypertensive, diabetic, ischemic heart disease, cerebrovascular accident, plus she had some upper GI bleed which has aspirated into her lungs. So her condition was very bad, and we were keeping on prognosticating, we were telling her serious condition and the seriousness of illness and the prognosis of her. And on this particular day what happened was her condition has deteriorated so much, and around 3 o'clock they have called me that she has become breathless. So I just went there. I saw that she was having more secretions, so I have seen her, I have examined her, and there was a lot of secretions coming. We have given suctioning, and the proper measures were taken. After some time again I was called to that patient, so that patient was not responding. So, and after everything was done, I went to this relative and told her that she has, I couldn't help, she has expired. And the moment she just slapped me.
Without no reason?
Without no reason, without any reason. Then they became abusive, totally demoralized. I was working, especially in this patient's case, she was there in my ward only for so many days, so I know how maybe.
Speaking to Goa 365, the president of the Goa Association of Resident Doctors, Dr. Vijay Singh Patel, told us about their demands.
See, the silent protest is targeted with the intention that we are not against the government. We are not satisfied. We are not saying that we are not satisfied with the security which Honorable Health Minister has provided us. Only our point is this: can we do some steps so that the future threats, future verbal or physical assaults can be prevented? We should set an example by giving some legislative correction or putting some grievance sale so that the future assaults will be taken strictly.
We'll spin to a short break. Stay with us. Welcome back. The Mormugao Port and Railway Workers Union today staged a protest against the privatization policy of the Mormugao Port Trust.
The rally, which gathered outside the General Administration Department of the Mormugao Port Trust, was attended by a large number of MPT workers. Speaking to Goa 365, Mr. Leonardo Rodriguez, Secretary of the Federation of Mormugao Port and Railway Workers Union, explained the reason for the 2-hour strike.
Protest against the illegal and anti-labor attitude displayed by our Honorable Chairman Sri Praveen Agrawal. Generally, the permission which he sought was only to operate this crane at best of breakwater, but subsequently he tried to convert it for operational purpose at even east of breakwater. If the crane is operated at east of breakwater, around 3,500 port and dock workers will be displaced. As it is, today there is no sufficient work for them due to this wrongly adopted privatization policy of the government at Mormugao Port.
The Health Minister Vishwajit Rane launched the Diabetes Care Program in the state last evening.
It may be recalled that early this month, the State Cabinet, taking cognizance of the increasing number of diabetics in the state, had approved a proposal from the State Health Department for entering into a memorandum of understanding with Novo Nordisk, a Danish world leader in diabetes care. This unique preventive healthcare program, which aims to detect cases of diabetes, especially in the rural areas of the state, is the first of its kind initiated by any state government in India.
They are also going to carry out programs of training the people in the PHC, CHCs, Goa Medical College. We will also be having a diabetic clinic in Goa Medical College and the new North Goa District Hospital. Apart from that, as mentioned, they will be also having a screening mobile van that will be going and carrying out tests in various panchayat-wise data they will be compiling and collecting, and to some extent we will also be giving them some sort of a support backup. The Director of Health Services, as far as the DHS is concerned, will be coordinating this program along with Novo Nordisk, and Goa Medical College, the Dean Goa Medical College, the Dr. Wiseman Pinto and our medical superintendent, they will be involved in under the supervision of the Dean Goa Medical College to see that this is well implemented.
Mr. Rane also spoke about other healthcare programs that the government could take up if the amount sanctioned under the Mediclaim scheme were increased.
Increase our amount sanctioned every year for Mediclaim, that's what I'm going to fight for, so that under additional allocation of Mediclaim, there are many programs which we can take up, and through medical reimbursement, tie up with such agencies and carry out several other programs, because there are so many agencies who are ready to tie up with the government. Is also an initiative from the government that is required.
Mr. Melvin D'Souza, Managing Director, Novo Nordisk India Private Limited, told us a little more about diabetes, which is also referred to as a silent killer.
The biggest problem with diabetes is diabetes doesn't itself, kill people. It is the complications of diabetes which kill people. And what we all know is that the faster you take help, the faster you try and detect the problem, the more easier it is to handle it. So what we are only trying to do is go out and create that awareness. We believe the media also can create this awareness, reach out to the masses.
Diabetes, a metabolic disorder that has reached alarming proportions, afflicting a large number of people, needs to be addressed seriously. And with India being labelled the diabetic capital of the world, it is commendable that the state government has taken this novel initiative to detect the increasing number of diabetics in the state.